and today I want to discuss a few points regarding what is a healthy heart diet. So when we talk about healthy heart diet, most people think that we need to take care of two things. One is salt and the other thing is fat, but it is not really correct. Why it is not correct is because salt restriction is not necessary for everybody. Similarly, fat intake should also not be restricted for everybody. So it's not something which is a universal truth or universal law. So what is a healthy heart diet? Basically, uh, the first thing that I would like to say about this is that the very name healthy heart diet means that there is one diet which is good for the heart, the other diet which is bad for the heart, then there is one diet which is good for patients with diabetes, and there is one diet which is good for cancer patients. It's not like that. A healthy diet is healthy diet. So what we need to know is a kind of diet which is good for everybody, with some caveats and some special instructions regarding how we can eat more sensibly when we want to either prevent heart disease or we want to have a overall and wholesome treatment of heart disease. So the basic principles of diet should be known to everybody. And what are these principles, irrespective of whether the person has got heart disease or not, is that one should be taking a variety of foods. So one should not have a restrictive kind of diets which have only some kinds of gradients, shunning all other kinds of things. So these dietary fads are really not good, because we need nutrients in adequate quantities and in a proportionate quantity, which can come only with eating a variety of foods. The second important principle, which is often missed, is that whatever we eat, we should be eating in moderation. And that's very important, basically because of two reasons. One, if we don't eat in moderation and we eat excessively, that leads to overweight and obesity, which is a very important cause of heart disease and diabetes, and also other degenerative and chronic diseases like arthritis. The other thing is that even if a person has got a normal cholesterol, a normal sugar, but he or she eats too much and without adequate amount of exercise, then it can actually disturb the metabolism in such a way that even if there is no predisposition to high cholesterol levels, the cholesterol levels can go high, the sugar levels can go high. So eating in moderation is very important. The third important factor, which is not so important nowadays, is the amount of the total dietary fat. Now you may say I am talking of two contradictory things simultaneously. Fat restriction is important, but it is not so important. What is the meaning of that? The meaning of that is that it is not the quantity of fat which is that important, but it is the quality of fat that is important. So one should not be restricting the fat intake too much. Restricting fat intake too much, like some patients may say that they are taking almost a fat free diet. Now it is good or bad? Actually it is bad, because they have to eat. And what will they eat? They will eat an imbalanced diet which will contain lot of carbohydrate, that will predispose to increase in blood fat levels, because excess of carbohydrate gets converted into fat, what so called the triglycerides, and it may reduce the good cholesterol. And this imbalanced diet is not good. So it has been observed in various clinical studies, observational studies, that if you restrict the fat too much, then it is not good for you. On the other hand, a diet which is wholesome in fat, consisting of something like 30% of the total calories from the fat in the diet, it is really not harmful. It is really not harmful. Rather, it is good, because it keeps the things in balance. So what is important is reducing the bad fats and opt for the good quality of fats. Now, what are these, good and bad fats? And without being very technical, let me say that the fats which are derived from the animals, which include not only the non-vegetarian foods like meats, chicken, fish, egg yellow, uh, also the fruit, the milk and milk products, they all contain animal fat basically, and this animal fat in technical language is called the saturated fat. So excess of this is avoidable because that leads to an increase in the bad cholesterol. On the other hand, the plant derived fats like the vegetable oils, they are good because they do not increase the bad cholesterol. The excess of everything is bad, but taken in moderation, any animal fat is okay, excess will be bad. So that is the basic mantra as far as the fat is concerned. And I will be speaking about how to curtail, saturated or animal fat in our diets, in a few minutes. But right now I am talking of the nutrients basically. One important factor to remember in the intake of fats is that one should never take hydrogenated fats. Now, these hydrogenated fats are basically, what are the hydrogenated fats? Hydrogenated fats are the plant derived fats which have been commercially and industrially hydrogenized so that they remain more stable for a longer time. Now, because they are hydrogenated, they become saturated and they are even more harmful than the animal fats. So, the hydrogenated fats are actually not possible to have in certain Western countries because they have been banned. But in a country like India and several other countries, they are not banned, but it is universally accepted that the intake of hydrogenated fat should be minimized. How it will be done, I will tell you in a few minutes. The total cholesterol intake, well, that also needs to be looked into, but that is not such an important thing. What is important is that you need to curtail the saturated fats. There are other factors in the diet like fiber. Fiber is very important, and fiber is basically derived from the plant-based, foods like nuts, green leafy vegetable, fruits, and whole cereals. Now, they are important because they improve the digestion, they prevent constipation, but more than that, they also reduce the cholesterol and blood glucose levels. So they are good for both patient with diabetes and patient with heart disease. And last thing in the dietary principles is that one should avoid excess of sugars. Excess of sugar. Sugar does not mean only sugar. Sugar means all sugar derived foods as well as the other variants of sugar like gur, that is jaggery, khand, bura, gur, shakkar, shahad, and anything where sugar is mixed like juices and cola drinks. So with this background in mind, let me say very briefly as to what one should be eating and one should not be eating. And if you really ask me, this can be conveyed only in a few words or few sentences. Now, what is this? And what I tell my patients is, broadly speaking, they should avoid all kinds of sugars as much as possible. Chini, khand, bura, gur, shakkar, shahad, fruit juices, cola drinks, uh, white bread, which has a lot of sugar, and not only sugar but also simple carbohydrates, and uh, uh, cakes, pastries, pizzas, burgers, all fast foods. Uh, Besides that, to minimize the saturated fat or the animal fat intake, one should be taking low fat milk and milk products. So skimmed milk or semi skimmed milk, dahi or curd made from the skimmed milk or a toned milk. uh, Cottage cheese can be taken, but avoid processed cheese, which is not only high in saturated fats but also high in the added salt, because salt is used as a preservative there. uh, Ghee and butter, now this is a controversial issue whether ghee and butter should be taken at all or not, but a sane advice is that they can be taken in moderation. Excess of everything is bad. Similarly, ghee and butter, excess of ghee and butter are also bad. So one should not have a simple one medium of cooking like mustard oil or sunflower oil or rice bran oil. These are all good oils, but one should be taking a different varieties of oils for different types of cooking. Like for example, तड़का लगाना है तो थोड़ा घी का लगा लें, कोई हर्ज नहीं है उसके अंदर. रोटी में थोड़ा घी लगाना है तो वो लगा लें, but desi ghee or butter should not be the sole cooking medium for most people, not only patient who have got heart disease, but also those people who want to prevent heart disease. Uh, Besides that, the excess of the wheat products like roti or root vegetable like aloo and other cereals like rice, particularly the polished white rice, excess should be avoided. Now there are certain people who are allergic to a wheat. They may have gluten sensitivity. For them obviously wheat products are not advisable, but otherwise for most people these things can be taken in moderation. But remember that a high carbohydrate diet is really not good. Unlike the Western, recommendations where they say that take lot of cereals, avoid non-veg as much as possible. Their diets are basically having excess of animal products like red meat, organ meats, chicken, fish, seafoods. So for them, reducing these items in the diet are important, increasing the amount of cereals that they take. But we are already taking a lot of cereals in this country, and therefore it's not a good idea to even increase it further because they are good. Because once again, as I said, fasting, the excess of everything is bad. Okay, now so much so about what not to eat or how much to eat, but are there any foods that are protective in nature? So yes, certainly foods that are protective in nature, they act positively. And what are these foods? These foods include fresh fruits, nuts of every variety, and green leafy vegetable. So all fruits could be taken, but once again, if you take excess of fruits, they also contain some sugar, they also have carbohydrate, so it may be counterproductive. So a certain amount of fruit every day is good, and it is said that if you take 200 grams of fruit every day, that's good. And using nuts every day on day-to-day basis instead of snacks like biscuits or other namkeens and mithaiya from a market, it is better when you have a tea or coffee, take some nuts instead of these items, and that will be good for you. And any nuts can be taken. All nuts are good. Tree nuts are good. Badam, mungfli, pista, akhrot, sub pistachio nut, all these nuts are good. There is nothing like that this nut is bad, that nut is good. Every nut is good. Maybe akhrot may be the best in form of composition, but one should, as I said, should be taking a variety of fruits. Therefore one should also be taking a variety of nuts like that. And green leafy vegetable also, they are protective in nature. One point, which is the last point that I want to say, is about the salt. Now, salt restriction is important for certain people. Those who are severely hypertensive, they are not getting controlled despite the fact that they are taking multiple medication. Their extreme salt restriction may be indicated, and it is to be done under the advice of a doctor. But otherwise, for most hypertensive people, a modest salt restriction is all that is necessary. The other condition where salt restriction is to be observed more carefully is patients who have got heart failure. So barring these conditions, and maybe if you go beyond cardiology and talk about the renal dysfunction, well, it is possible that you may require more severe salt restriction. But for most people who want to either prevent hypertension or they want to prevent heart failure in future, or they have been advised to have modest salt restriction, well, it, not adding salt on the table is mostly good enough for most people when they just want to have prevention or control of mild to moderate hypertension. So in the end, I will repeat that eating a different variety of foods in each food group is important. One should not be limiting to one kind of a thing, like taking just one kind of a fruit or just one kind of a nut, or taking rice but no chawal, like that. And eating out once in a while is okay, but eating out is something that leads to excessive eating in most cases. That should be avoided in excess. Now, what is the definition of excess? Depends on your weight. If the weight is excessive, it is a good idea not to eat out at all, because one tends to eat out whenever one goes out. It is difficult to limit at that time. So moderation is important both in the quality and quantity of food, and that's all I would like to say. Thank you very much.